there are about 910 palliative care centers in India, and out of them, 840 are in Kerala. So till about 4 or 5 years ago, there were no sort of organized palliative care services and certainly no education and training facilities for palliative care in eastern India. Those of the few people who were interested would go to Pallium India in Kerala to learn, but we first started the sort of sensitization workshop once a year with my UK team in about 2009, which then sort of built up a bit of momentum and interest in palliative care. And this was at a not-for-profit cancer center in Thakurpukur in Kolkata. And on the back of that, another charitable organization called Indo-American Cancer Association funded some salaries for staff, which resulted in a palliative care department at that cancer center. So they started having an outpatient facility. They developed the capacity to organize home visits to see cancer patients in the community. And they also sort of had inpatients who they could offer palliative care to. So that was the background, and this developed over a period of about 3 to 4 years, following which sort of THET had been aware of our work, of our health partnerships work in developing palliative care, and then we got the grant to develop a Train the Trainers education and training program. NHS Kolkata-Brighton Health Partnership is primarily built on trust and good understanding between the two partners. That has been key to the development of the partnership. I had very good support from the chief executive of my trust, who signed all the paperwork to go ahead with the partnership, and I had a very good understanding with the director of the not-for-profit cancer center there. So our mission goals were the same. So that helped to cement the partnership and strengthen it. Health partnership led to further developments, led to further collaborations and networking, led to the development of the outpatient, inpatient, home visit services, a palliative care department functioning, which then led to the THET grant, which then led on to the education and training, Train the Trainers program, and then to the community palliative care clinics. So all of this started off actually with the health partnership, and in hindsight, we wouldn't have been so far down the road if we hadn't had a health partnership in the first place. The trainees who did the course, who are now sort of practicing as palliative care doctors or nurses or social workers, they feel more confident in dealing with difficult patients with sort of complex cancer diagnosis and distressing symptoms, which they would have struggled with initially. We found nurses much better at documenting pain scores, and doctors have become much more confident in prescribing morphine because they hadn't had much exposure to actually prescribing it. And one of the fundamental sort of challenges we had when we set up the course was that we should make it a practical course, a hands-on training course, because other organizations did do online training courses which were all theoretical. And because there was no organized palliative care service, no one could provide a practical palliative care training course. And the fact that we had this palliative care department in Thakurpukur in Kolkata, and we had funding for the education training through the THET grant, meant we could develop hands-on practical Train the Trainers training in palliative care, and that showed in sort of over 90% satisfaction in the trainee surveys. It was also clear from the patient satisfaction surveys from the home visits that the patients felt that the doctors treated them differently to how they were treated by doctors in the past, in the sense that they were asked symptom-specific questions. There were sort of broken bad news in a very gentle way. They were asked about their psychosocial needs, spiritual needs. So they felt, some of the patients' comments were that we felt it was a different consultation to what we were used to. So there were clearly qualitative improvements in the performance of the doctors and nurses during the home visits that I would say we couldn't attribute to the benefits of the education and training program. One of the things we realized is that this was completely unintended benefit, that actually starting the palliative care clinics improved cancer care, because that is totally different to what we see as palliative care here, because most of the palliative care patients here are referrals from oncologists like me when we know we've run out of anti-cancer treatments to give and the patient is not fit enough for anything more. But because the community palliative care clinics were set up initially as cancer patient information support centers, a lot of patients with symptoms suggestive of cancer came to those clinics and they got sort of advice through email from me that helped to direct their cancer referral pathway, and they got sort of access to the appropriate step that they needed to take. So like someone came in with fluid around the lungs, they need to have that fluid drained, went to the right place, had it drained. It showed they had lung cancer. They went on to have lung cancer treatment within a week. So actually the palliative care clinics, although had been set up with the intention of only offering palliative care, they actually ended up improving cancer care as well.